Florida Voices for Health, we go out into the community, we do a lot of outreach events. We got the opportunity to participate in a remote area medical free clinic event that was happening in Bradenton, Florida. And it was there we really got to engage with folks who were just trying to get access to care for, many of them, for the first time in years. But they had to choose two of the three options that were available between vision, dental, and just physical health. To a man, everyone chose dental care and then decided between the other two, which really jumped out at us as being, wow, maybe there's an issue here.
Florida Voices is, I think, an exemplar sort of piece of the work that we have invested in historically. We supported them through the grassroots engagement initiative, which was focused on sort of changing the voice of stakeholders within oral health.
We decided that at our core, we wanted to build people power. Our mission really is to increase access to healthcare for low-income and moderate-income Floridians, where you have children, 1 in 4 have a preventable oral health disease, and even among adults, you have 5 million Floridians who live in what we call dental provider shortage areas, meaning there's no access to a dentist whatsoever.
One of the things that I really value about our work is that there's intentional investment in community-based organizations to drive their voice in terms of advocacy and policy change. We don't just focus on programs, but really think high level and think about sort of the underlying situations that influence how individuals experience oral health. So the barriers, the conditions, and the challenges that they experience.
When I think about our 5 activation areas, ranging from education to research, grant making, health improvement, and advocacy, Grantmaking really works with each of those areas of activation. It lifts up community voice. It helps to galvanize different stakeholders at the community level, the local level, and also the federal level to really ensure that those activation areas are meeting our intended impact of providing underserved and marginalized populations with equitable and accessible oral health care.
We, for a long time, have talked about the need to increase access to healthcare overall, but I think what gets lost so often is oral health in that conversation. Working with CareQuest Institute has allowed us to lift that up and give oral health a significant voice in the overall oral health advocacy movement.
I'm incredibly proud of the relationship that we have developed over time with all of our grantees, ensuring that there's representation, that they have a voice at the table, and that we work in partnership to ensure their success.